A picture speaks 1,000 words. It's an old adage. And today, I'm going to talk about a word, a disease, which would conjure the image. And this image would be used to describe the entirety of the disease. And I'm talking about a disease called MoyaMoya. MoyaMoya is a Japanese word which suggests a puff of smoke. Yes, a puff of smoke. It's a word which easily conjures that image. The angiogram of a patient who suffers from MoyaMoya disease typically shows the puff of smoke appearance. Now, if you just know that bit, you'll know the pathology of the disease. What happens in this disease is the two major arteries which supply the brain, the two internal carotid arteries, gradually get stenosed. And as they get stenosed or blocked, the smaller vessels, to compensate for the lack of blood supply, start opening up in the periphery. So to replace these two large vessels, the smaller vessels open up. And the smaller vessels need to actually form a good network to achieve adequate blood supply. And this is what leads to the appearance of a puff of smoke. Now, once we know the pathology, the interesting thing about this picture is you can actually describe or guess the clinical presentation too based on this image. So when we see the normal angiogram, we see the two large vessels supplying the brain and two smaller vessels from behind, the vertebral arteries supplying the brain. But in patients with MoyaMoya, obviously the two anterior ones or the two larger ones are lacking. So what does it mean? In spite of the smaller vessels dilating, I'm very sure you would have understood there is overall a deficit in the blood supply to the brain. And once there is a deficit or a lack of blood supply to the brain, what happens is a stroke. So these patients typically present with TIAs or mini strokes initially, where they recover from it. But at some point, the stroke does settle down to leave deficits, and that too permanent deficits. So that's one way of presentation. The other way is when these small vessels now, which you can see as a puff of smoke, are receiving more blood than what it is actually expected to, they dilate to an extent, but at some point they do give way, they do rupture, and this rupture leads to a bleed in the brain. So that's the second most common way of presentation, that is bleed into the brain. The other presentation would obviously be because of these small destructions happening in the brain, patients are more prone to abnormal electrical activities, which leads to seizures. So this is how they would present to us with. So this image alone can tell us a lot of things about the pathology, about the presentation. Now let's talk about the treatment. When we look at the image, again we see a puff of smoke, but we also see the external carotid arteries. The external carotid arteries originate from the same artery which gives origin to the internal carotid artery, but they are not involved by the disease process. The external carotid artery supplies the neck, the face and the scalp. It does not supply structures inside the brain, but outside it does. And since it is available so close to the brain, we can actually use for treatment. And what is the treatment? The treatment is obvious. There is lack of blood supply to the brain. So what we need to do is augment that blood supply. And how do we do it? We use the external carotid artery branches to augment the blood supply. This can be done by two main methods. One would be a direct anastomosis or a direct bypass, or an indirect bypass. What is a direct bypass? Direct bypass is when one of the terminal branches, that is the superficial temporal artery of the external carotid artery, is taken and is directly strewn to the middle cerebral artery, bringing about a change in the amount of blood supply going to the brain, augmenting it and making the symptoms almost go away. The other would be an indirect bypass, where without actually doing an anastomosis, we do something called a synangiosis, where the artery, the superficial temporal artery, is simply laid over the brain, and the brain gradually acquires small blood vessels from this superficial temporal artery and acquires some amount of blood supply. Similarly, another procedure would be called encephalomyoarteriosyngiosis, where a temporalis muscle is placed over the brain and the blood supply from this muscle is used to augment the blood supply to the brain. Apart from this direct and indirect bypass procedures, there is another procedure called a multiple burr surgery. So we make multiple holes in the skull and then open the dura over there. And since any trauma to any part of the body invites inflammation, so does this process, and this inflammation brings with it blood, and this blood is again used by the brain for nourishing itself. And once this is achieved, we see a good amount of decrease in the symptoms. The decrease would be seen in the form of less strokes, less possibility of bleed, and yes, even seizures go down once the patient has the surgery done. So next time you see somebody smoke and you see a puff of smoke appear in the air, yes, it would be a good idea to warn him about cancer, but at the same time, you can think of MoyaMoya disease, a name which conjures up an image which tells us all about the disease. Thank you.